Napro FertilityCare is an advanced scientific approach to infertility and recurrent miscarriage. Our aim is to find the problem and fix it. We open a window to understanding fertility that no other approach offers. We can treat nearly every category of infertility, including reduced ovarian reserve, male factor infertility, polycystic ovaries, endometriosis, just to name a few. So the age range for Napro FertilityCare for women is up to and including 42, although we have had some success beyond that age. If we have a couple who are told they've had all their investigations, there's nothing further that can be done, frequently with Napro FertilityCare we may find an underlying cause that may not have been detected before, and treatment could prove successful.
Over 4.5 years, I had 6 miscarriages in total. I attended so many different doctors and clinics and hospitals, and I had so much testing done, but I was never given a clear diagnosis on what my problem was. Eventually, I made my way to Napro, and luckily I ended up having my son.
Well, we've been trying to get pregnant for 2 years. I kind of met the doctors in January 2012. They discovered that I had numerous problems, including low progesterone, high estrogen, low AMH, thyroid antibodies and hyperthyroidism. And following surgery, I discovered I had endometriosis and a receptor in my womb. So following those surgeries and all rectification of my problems and my issues, I got pregnant. It was about 18 months after starting Napro.
We went to the GP, made an appointment with the GP who sent me to the Lourdes Hospital, and they decided to do a laparoscopy then, so we were eventually called for that after about 12 months. They found out then that my left tube was blocked. They told me that there was nothing more that they could do for me. October then was my appointment with Napro, where they told me that the blocked tube wasn't an issue at all. After 3 years of trying to conceive, we were with Napro for about 4 months, and we conceived naturally after that.
What makes us different from other fertility treatments is we often find multiple factors that contribute to subfertility, and we frequently look for things that aren't detected in routine testing. Napro FertilityCare is surprisingly inexpensive compared to other fertility treatments, while our results are comparable and often superior.
At the other clinics, I always felt like I wasn't really a person. I was a client or a patient attending the clinics. There was never a feeling of having a personal relationship. And when I went to Napro, from the first person who greeted me at the front desk to the doctors, I really felt welcomed, and I felt like they cared and they wanted to help me have a baby. They genuinely really wanted it for me.
I was never excluded at any point, and where I had such a knowledge, I was there able to support Anya.
The pregnancy itself went very well. I was a nervous wreck. I was so worried about the pregnancy. I didn't want to tell anybody about it. I didn't want to jinx it. I didn't want to buy anything in the house. But with every phone call I made to Napro, they reassured me that everything was going to be okay.
I would definitely recommend Napro to anyone struggling with fertility problems or, like myself, recurrent miscarriage.
The success rate with Napro FertilityCare is 50% for your average couple. If you've previously tried IVF, we would expect a success rate of 30%, and if you have multiple repeated miscarriages, up to 80% of couples can achieve success.
You're involved in each step, and that's something that I found incredibly refreshing, as opposed to being sent away with a bundle of prescriptions.
I would say to anybody who's trying for a baby, let it be for a long period or a short period of time, go to Napro. You know, you weren't just a number on a list waiting to be seen, and they were excellent. I mean, there was no comparison between them and the other avenues that we had started to explore. They were brilliant from start to finish, yeah.